Our Fill in the Gaps tool allows you to run a side-by-side comparison of how a hospital indemnity plan can help fill in the coverage gaps of an MA plan, especially with the inpatient hospital care copay. So we're seeing a significant jump in Medicare Advantage and hospital indemnity quoting during AEP and even after AEP when agents tend to revisit their Medicare Advantage clients about their coverage gaps. So to use this feature, what we're going to do is we're going to first run a Medicare Advantage quote, and then you would just select the plan in which that your client is interested in. So for example, if my client's interested in this Coventry Healthcare, I'm going to select it so it turns green. In the upper left-hand corner here, we see Compare Quotes where that plan is located. I'm going to go ahead and click on that Compare Quotes. So when I pull up my Medicare Advantage plan, this is where I'm going to see all the plan details. I'm especially going to look here at the inpatient hospital care to see how many days that they are going to have to pay out of pocket for that. That way I can match it to the proper hospital indemnity plan. So up here at the top of the screen, we're going to see this blue Fill in the Gaps button. So I'm just going to go ahead and click on that, and then I'm going to run a simple quote for a hospital indemnity plan, putting in the client's zip code, age, gender, and tobacco status that would match their MA plan. And I'll hit Run Quote. Then it's going to populate a drop down of all the plans that are available for me to choose for a hospital indemnity. So I can pick which plan I want to do, especially I want to look at what the days of the inpatient hospital care was on my MA plan. So for the MA plan that I selected, I would have had to pay for days 1 through 6. So I'm going to select this medical insurance company plan that has the 6 days, and I'm going to hit Add to Comparison. Now it's going to bring up a side-by-side comparison of the MA plan and the hospital indemnity plan that I selected here. So as I scroll through, it's going to tell me in alphabetical order here what the MA plan is covering, and then for the hospital indemnity plan, is there any riders that I can add to the plan to help fill that coverage gap. So for example, the ambulance, the in-network pay is $350 copay. So if I wanted to add an ambulance rider, it's going to tell me here in green how much more additional premium my client is going to pay monthly to add that rider. So we see just over $3 here. I'm going to continue scrolling through. I have an option of adding a lump sum cancer, emergency room visit. Maybe I'll tack on a 50-day benefit there that adds $4 to the premium. Outpatient rehab benefits I could absolutely add, outpatient surgery, but what I'm going to really focus in here as I scroll down again and really focus on this base plan, the hospital confinement benefits. So for this particular plan, the copay is about $269 for days 1 through 6. So my benefit amount, I may choose $250 to see what that is. That's going to be an additional $15.20, or maybe I just want to cover it fully at the $275. That's only $16. So I'll go ahead and add that. Looking through here, if I wanted, I don't technically need to add any skilled nursing riders, so I should be all good there. So as I scroll back up to the top here, now I can see what that premium is going to be monthly for their hospital indemnity plan. So now I can give them this option of how they can fill in the gaps, and that's only going to cost them about $24 a month. If I wanted to save this as a PDF, maybe save it for my records, print it off just so I have that as well, you do have those options. Again, this is a great feature to use during AEP when you are talking to your clients about their Medicare Advantage plan, pitching a hospital indemnity plan. We do have this great feature available, so I really hope that you take advantage of it.